Good morning, everyone. I'm here to present my paper on intravitreal anti-VEGF in silicone oil-filled eyes, and especially in patients of polypoidal choroidal vasculopathy. We have no financial disclosures. So as we all know, PCV is an important cause of visual loss in elderly and is characterized by characteristic polypoidal or aneurysmal lesions with or without a branching vascular network. It was considered a subtype of neovascular AMD at first. However, now we know that there are significant variations. So to look at PCV, we could see it as massive subretinal exudation in the retina. It could also present as large subretinal hemorrhages or even a breakthrough hemorrhage, and could be of central, peripapillary or peripheral type. The gold standard of investigation is indocyanine green angiography. However, typical features are also seen on OCT, which have been documented. When it comes to treatment of PCV, it is two-pronged. One is the treatment of the cause, such as laser when polyps are present in the safe zone. PDT, however, there is an issue of availability of verteporfin, anti-VEGF, or a combined PDT and anti-VEGF, alongside the treatment of associated findings, such as if there's a large subretinal hemorrhage, we may need to do a pneumodisplacement. An old hemorrhage would require a tissue plasminogen activator injection alongside, and if there is vitreous hemorrhage, we may need to do a PPP with a hyaloid peel with or without the injection. However, post-operatively, do we need to treat the cause, and how? So this is a first case. This is a patient, a middle-aged male who presented to us with diminution of vision in the right eye. There was vitreous hemorrhage, as can be seen here, which was confirmed on ultrasonography, and the patient was taken up for pars plana vitrectomy. Upon clearing up of the vitreous hemorrhage up to the extent possible, we thereafter did a close base shave, removed whatever vitreous we could, and then took a 38 gauge cannula with tissue plasminogen activator and injected tissue plasminogen activator subretinally. In this case, as you can see, large bullae of subretinal blood here. This is the tissue plasminogen activator injection. This was followed by a fluid air exchange and then silicone oil injection. So while the silicone oil was present in the eye, we continued to give the patient multiple injections of intravitreal aflibercept at 1 month intervals so as to facilitate drying up of the retina and ensure quiescence of the underlying disease process, as you can see here, and the retina is progressively drying up. This is the post-operative picture of the patient with a stable retina after silicone oil removal and cataract surgery combined. This is yet another case of another patient who presented with vitreous hemorrhage. And again, multiple injections of aflibercept were given. And a patient who was already under treatment for PCV, however, presented with breakthrough vitreous hemorrhage, was taken up for pars plana vitrectomy with silicone oil, along with, again, serial injections of intravitreal aflibercept. So this is not the first instance. We have quite a few reported instances in literature of anti-VEGF in silicone oil-filled eyes. However, they have been given for choroidal neovascular membranes and PDR. However, we can do a similar treatment for eyes of PCV to ensure the regression of polyps, because it is important to remember not just to remove the hemorrhage and clear the media and allow the retina to settle, but also we have to prevent recurrences and treat the basic pathology alongside, which in this case is by using multiple intravitreal anti-VEGF injections. Thank you.
How frequently were the injections given?
Sir, at 1 month intervals. And those patients who were already on treatment were eventually taken up for treat and extend protocol as and how their protocols were.
And what was the visual acuity outcome?
So, ma'am, for patients who already had scarring, the visual acuity was similar in the range of 660 or finger counting. However, one or two of our patients have done really well, and they are at about 618 or 636. The first patient that I showed you was at 636 visual acuity post-operatively.
Whether the half-life changes after the vitrectomized eye?
So sir, there are studies in which the half-life has shown to be less. However, all these patients who were injected with anti-VEGF in patients of choroidal neovascular membranes, they were shown to have a similar effect and were injected at 1 month intervals only in all the other instances that we have found in literature.
Thank you.
Thank you, sir.